This is Jeremy with CryoClarity, and in this video we're going to be talking about the valves of the heart. So we have 4 different valves of the heart: the tricuspid valve, the pulmonary valve, the mitral or bicuspid valve, and the aortic valve seen back here. These valves are divided into 2 different categories. We have 2 atrioventricular valves, meaning 2 valves that sit between the atria and ventricles respectively. And those 2 valves are going to be the tricuspid valve sitting between the right atrium and right ventricle, and the mitral or bicuspid valve between the left atrium and left ventricle. Whenever the tricuspid and mitral valves, or collectively known as the AV atrioventricular valves, close, that gives us the lub sound with the typical lub-dub heartbeat. Now the 2 other valves are known as semilunar valves, and those are the pulmonary valve and the aortic valve. Blood goes through the pulmonary valve from the right ventricle, making its way into the pulmonary trunk and the left and right pulmonary arteries before going to the lungs for oxygenation. Blood makes its way through the aortic valve from the left ventricle to enter the aorta and go to systemic circulation. The pulmonary valve and the aortic valves are categorized as semilunar valves, and whenever these valves close, that gives us the dub sound in that typical lub-dub heartbeat. To go a step further, whenever we talk about that typical lub-dub sound with the heartbeat, that lub sound that we said was associated with the tricuspid and mitral or the atrioventricular valves closing is associated with ventricular contraction termed systole, whereas that dub sound, which is characterized by the semilunar valves or the pulmonary and atrial valves closing, is associated with ventricular relaxation termed diastole.